Hello everyone, I am Nirali Patel from PharmD third year. I am a student in a Maliba Pharmacy College. Here I will discuss about the vasopressin, their source, history, their mechanism of action, uses, side effect, contraindication, drug-drug interaction, and some MCQ related to vasopressin. So let's start with the classification. The antidiuretic. Antidiuretics are three classes: antidiuretics hormone and its analog that include the vasopressin, desmopressin, lipressin, and terlipressin. Natriuretic that include the thiazide and amiloride. Then miscellaneous, it include the carbamazepine, chlorpropamide, and indomethacin. Here I discuss about the vasopressin. So the history of the vasopressin is in 1895 the discovery by Oliver and Schaffer of the mammalian pressure effect of a cow pituitary extract constituted the starting point of a more than a century of active research on a structure and function of a vertebra neurohypophyseal hormone. The structure of this neurohypophyseal hormone, mammalian vasopressin AVP, means the arginine vasopressin or antidiuretic hormone ADH, was discovered in 1954 by Acker and Chavez. That is the structure. This is the structure of the vasopressin and its chemical formula: C92 H130 N28 O24 S4. The class of the vasopressin is the antidiuretic hormone. Vasopressin is a hormone synthesized from the AVP gene, means arginine vasopressin gene, as a peptide prohormone in a neuron in the hypothalamus, and it's converted to vasopressin and related into the circulation from the posterior pituitary gland. Other names of vasopressin is antidiuretic hormone, arginine vasopressin, and argipressin. The source of the vasopressin is the vasopressin that is measured in the peripheral blood is almost all derived from secretion from the posterior pituitary gland. Vasopressin is produced by magnocellular neurosecretory neuron in the paraventricular nucleus of hypothalamus (PVN) and supraoptic nucleus (SON). The brand name of vasopressin is Vasostrict and ADH. Why it is called vasopressin? The primary function of vasopressin in the body is to regulate extracellular fluid volume by regulating the renal handling of water, although it is also a vasoconstrictor and pressure agent. That's why it's called is vasopressin. Some basic information about the vasopressin is the human antidiuretic hormone ADH is 8-arginine vasopressin, which is a non-peptide secreted by the posterior pituitary neurohypophysis along with the oxytocin. Then mechanism of action of the vasopressin. First, it stimulate, means it rise the plasma osmolarity and contraction of extracellular fluid. Then it can generate the impulse from the baroreceptor, and it affect the posterior pituitary gland, and it secrete the vasopressin. Then hypothalamus nerve cell bodies that include the supraoptic nucleus and paraventricular nucleus that can synthesize the vasopressin along with the protein neurophysin. Then transported to nerve ending in the median eminence and pars nervosa. Then osmoreceptor present in a hypothalamus and volume receptor that present in a left atrium, ventricles, and pulmonary vein primarily regulate the rate of the vasopressin release. Vasopressin receptor. These are the G protein coupled cell membrane receptor. These are two types, V1 and V2. V1 has another two types, V1A and V1B. V1A present on the blood vessels, uterine interstitial cell in the renal medulla, adipose tissue, brain, liver, etc. V1b, it is also called as a V3. It localized to the anterior pituitary, certain area in a brain and in pancreas. V2 receptor located primarily on a principal cell of collecting duct in the kidney, that it regulate their water permeability through cyclic AMP production. Some V2 receptor also present on the TAL, means a thick ascending loop of Henle, and V2 receptor also present on the endothelium of blood vessels. Then some trigger factors are trigger the vasopressin release, that is a hyperosmolarity, reduce baroreceptor firing, angiotensin 2, increase the sympathetic tone that can trigger the hypothalamus, and it affect the posterior pituitary. So posterior pituitary can release the vasopressin. We have already seen that vasopressin have a two receptor, V1 and V2. V2 receptor located on blood vessels. V2 receptor act by the vasoconstriction, that increase the systemic vascular resistance, and it can lead to increase the blood pressure. And V2 receptor located on a kidney act by the increased reabsorption of water, and it increase the circulation of volume. Then it can lead to increase the blood pressure. So mechanism of action of V1 receptor. First is a V1 vasopressin bind with a V1 receptor, and it hydrolysis of a phosphatidyl inositol 4,5 biphosphate into IP3 inositol triphosphate and DAG diacyl glycerol by phospholipase C. Activate the protein kinase C and it open the voltage gated calcium channel while the closing the potassium channel, it resulting in the vasoconstriction. Then V1 receptor also present in the renal. That V1 action of vasopressin, it constrict the vasorecta and diminish blood flow to inner medulla, then prevent the urine formation. Then V2 receptor, mechanism of action of V2 receptor. We have already seen that V2 receptor present on the kidney. There are several mechanisms of action of a V2 receptor. First is it increase the cyclic AMP intracellularly, and then it activate the protein kinase A that can lead to phosphorylation of a protein, and it promote the exocytosis of aquaporin 2 in the apical membrane, and it increase the water permeability, and it contribute the antidiuresis action. Second is it activate the vasopressin regulate urea transporter VRUT or VUT1, that it increase the urea permeability of a terminal parts of collecting duct, it increase the medullary hypertonicity, and it contribute the antidiuresis action. Third mechanism is it also present in a ascending loop of Henle. It activate the Na plus K plus 2Cl minus co-transporter, and it increase the synthesis for long term. Then it increase the medullary hypertonicity, and it contribute the antidiuresis action. Other action of the vasopressin is on uterus, on CNS and regulation of body temperature and ACTH release. Then pharmacokinetic of vasopressin is AVP. Vasopressin is inactive orally because it is destroyed by the trypsin. It can administered by any parenteral route or by intranasal application. Metabolism. The peptide chain of vasopressin is rapidly cleaved enzymatically in many organs, especially in a liver and kidney. Route of elimination, especially through urine, where only 6% of the dose is excreted unchanged. Plasma half-life is a short, 25 minutes. Action of aqueous Aqueous vasopressin lasts 3 to 4 hours. Example is postacton 10 unit injection intramuscularly, intravenous and subcutaneous administration. Then doses of the vasopressin is a normal dose for adult and pediatric is a 20 unit per ml. In abdominal distension 5 units administered intramuscularly route initially may increase to 10 units. In diabetes insipidus for adult 5 to 10 units intramuscularly or subcutaneous for 12 hours. For pediatric 2.5 to 10 units intramuscularly, subcutaneous or intranasally. For abdominal roentgenography for adult 10 units 0.5 ml IM or SC 2 hours before procedure, 10 units intramuscularly 30 minutes before procedure. Then hepatic impairment for adult lower dose may be required to achieve response. Then gastrointestinal hemorrhage for adult 0.4 unit per minute IV initially. For pediatric 0.3 unit per kg IV not to exceed 20 unit. In vasodilatory shock 0.01 to 0.04 units per minute intravenous. Then vasopressin analog. First is a lipressin. It is a 8 lysine vasopressin, less potent than vasopressin, act on a V1 and V2 receptor. Then longer duration of action is a 4 to 6 hour. Example is Patrocin, Vasopin. Its dose is 20 IU per ml injection and 10 IU per IU in subcutaneous or intramuscularly. Then terlipressin, it is a prodrug of vasopressin used for a bleeding esophageal varices. Longer acting, dose 2 mg IV, repeated 1 to 2 mg every 4 to 6 hours. Their example is glioresin, T-pressin or terlinins. Then third is a desmopressin. It is a selective V2 agonist, 12 times more potent than EVP, and half-life is 1 to 2 hours. Then duration of action is 8 to 12 hours. Intranasal route, bioavailability 10 to 20%. In oral route, bioavailability is 1 to 2%. Dose for intranasal for adult 10 to 40 microgram per day in a 2 to 3 divided dose. For children in a bedwetting 0.1 to 0.2 mg thrice a day. Then parenteral dose subcutaneous or intramuscular given 2 to 4 microgram per day in 2 to 3 divided dose. An example is a minirin 100 microgram per ml for nasal spray and 0.1 mg per tablet. Then use of the vasopressin is based on the V2 action. First is the diabetes insipidus. Diabetes insipidus is caused by the lack of vasopressin, which prevent the dehydration or the kidney's inability to respond to vasopressin. Then vasopressin enabled to the kidney to retain the water in the body. So in this condition vasopressin are given. Then bedwetting in children and nocturia in adult. Then desmopressin are given by intranasal or oral. Then renal concentration test, 5 to 10 unit intramuscularly of aqueous vasopressin or 2 microgram of desmopressin are given. It causes the maximum urinary concentration which measured by the urinary specific gravity. Then hemophilia, von Willebrand's disease, AVP may check the bleeding by releasing the coagulation factor 8 and 1 Wilbrand's factor. Then desmopressin are the preferred. Based on a V1 action, first is a bleeding esophageal varices. Vasopressin, mainly terlipressin, is stop the bleeding by constricting a mesenteric blood vessel and reducing the blood flow through the liver to the varices and allowing the clot formation. And before abdominal radiography, then vasopressin has been occasionally used to drive out the gases from the bowel. Then another uses of the vasopressin is the vasopressin injection used to increase blood pressure in adult with a vasodilatory shock, act on a kidney to reduce the flow of the urine, used to treat of vasopressin used to treat or prevent the certain condition of the stomach after surgery or during the abdominal x-ray. Then side effect, headache, flushing, allergic reaction, nasal irritation, congestion, rhinitis, ulceration, epistaxis for topical use. Then systemic side effect is nausea, abdominal cramp, fluid retention, and hyponatremia. Hyponatremia is due to the shift of the water intracellularly, resulting in a cerebral edema that can produce the headache, nausea, vomiting, etc. Vasopressin can also cause the bradycardia and constricting coronary vessels. Then contraindication of the vasopressin, first is a ischemic heart disease. Vasopressin produces a myocardial ischemia by the constricting small and non-diseased coronary arteries. Then second is the chronic nephritis, and then hypertension. In a hypertension, vasopressin selectively raises free water reabsorption in the kidney and result in a blood vessels elevation, and in a psychogenic polydipsia. Then drug interaction, first is carbamazepine, chloropropamide, clofibret, urea, fludrocortisone, tricyclic antidepressant. It may potentiate the antidiuretic action of vasopressin. Then damaclocycline, noradrenaline, lithium, heparin, alcohol. It may decrease the antidiuretic action of vasopressin. Damaclocycline is the produce an nephrogenic diabetes insipidus by reducing the vasopressin, stimulated generation of a cyclic AMP in a collecting duct, thereby it decrease the urine concentration. And food ganglionic blocker, it may increase sensitivity to the pressure effect of a vasopressin. Then food interaction, alcohol, it reduces the effect of the vasopressin. Counseling point, avoid alcohol that can make vasopressin less effective. If a patient have any heart disease or history, then tell your doctor about all your other medicine. And then MCQs, first V1B, also known as A, V2, B, V3, C, V1, D, V4. The answer is B, V3. Which of the following peptide is a selective vasopressin V2 receptor agonist? A, desmopressin, B, terlipressin, C, arginine vasopressin, D, lipressin. The answer is desmopressin. Desmopressin is a V2 receptor agonist. It is a neurogenic receptor, not a nephrogenic receptor. V1 receptor is located at A, kidney, B, CNS, C, blood vessels, and D, uterus. The answer is C, blood vessels. We have already seen that V1 receptor present on the blood vessels and V2 receptor present on the kidney. Then fourth, which drug used to control bleeding from esophageal varices? A. Lipressin, B. Arginine, vasopressin, D. Desmopressin, and D. Terlipressin. The answer is D. Terlipressin, because it stopped the bleeding by constricting the mesenteric blood vessels and reducing the blood flow, and it allowing the clot formation. Fifth, the following tissue is the most sensitive to vasopressin: A. Intestinal smooth muscle, B. Renal collecting duct, C. CNS, D. Uterus. The answer is B. Renal collecting duct. Sixth, vasopressin secreted by A. Kidney, B. Posterior pituitary, C. Hypothalamus, D. Blood vessels. The answer is B. Posterior pituitary. Vasopressin is synthesized from the hypothalamus, but it's secreted by the posterior pituitary. Thank you.